Hold
Okay.
on. Okay. Okay, good evening, everybody, and thank you so much for attending the Preventing COVID-19 Virus Transmission and Mass Screening for the Workplace. Today, we have with us our guest speaker, Dr. 𝗪𝗥𝗡𝗩𝗚. Thank you, Dr. Lim, for agreeing to speak at our webinar. And just before we start, a little on the meeting etiquette. Okay, you will be noticed that all of you are muted. This is done so that to prevent any disruptions during the webinar. So what happened is, after Dr. Lim's presentation, we will unmute everybody. So at that time, you may raise your Q&A questions. You either type your questions into the chat box, or if not, you raise your hands and we will allow you to speak. So it has to be coordinated, so we don't want everybody speaking at one time. So you either type your question into the chat box once again, or you raise your hand and we will allow you to speak. Okay, I'm going to share with you the QR code so that you can access the presentations. Okay, you can scan the QR code to access Dr. Lim's presentation, or if not, we will type in the meeting link or the presentation link into the chat box, and you may click on the link to access the presentation. And this presentation, by the way, is on the MPMA website. Also today, we have with us Mr. 𝗪𝗣𝗩𝗚. Mr. 𝗪𝗪𝗡 is our Secretary General, and he will be moderating today's webinar. I'll pass the floor to you, Mr. 𝗪𝗣𝗩𝗚. Thank you so much.
Okay, thank you very much, Sujata. I'm unmuted, that's good. Thank you everyone for logging in. This is an overwhelming response. This is the biggest online, offline event that MPMA has ever had in my 20 over years in MPMA. Our biggest was about 220 registrants, I think, for one of our international conferences, but this one is 315, on record. So let me introduce Dr. Lim. Dr. 𝗪𝗥𝗡𝗩𝗚 is a graduate from University of Glasgow with a Bachelor of Surgery and a Bachelor of Medicine. And he is also a member of the Royal College of Physicians in the UK and a member of the Fellow of Royal College of Physicians in Edinburgh. So, oh, you've got it on your screen. Formerly consultant, nephrologist, and director of Clinical Research Center of Health Malaysia. He's currently the senior partner in Yun Consulting and serves as consultant to many companies in biotech, pharmaceutical, and healthcare industry in a variety of areas, including health product development, health policy, and healthcare research. Dr. Lim has been a WHO consultant for clinical research to China in 2002 and 2003, and consultant on clinical research to the Aga Khan University, that's in Pakistan, I gather, and also University Medical Center, HCM, and MOH in Vietnam. HCM, I guess, is Ho Chi Minh or whatever. The Health Ministry of Brunei in 2007 to 2008. King Saud University College of Medical, Saudi Arabia, 2009. He's also the adjunct professor at the International Medical University here in Malaya. Throughout his career, he has been very active conducting medical research on a variety of diseases, therapies, and so on. So he has numerous publications in reputable journals. His research assessing doctors' performance, application of the 𝗧𝗧 technique in monitoring doctors' performance. 𝗧𝗧 is the cumulative sum technique. So he was nominated as the best paper, or his paper was nominated as best paper published for the Peter Reisenstein Prize. So I think that's enough qualification for us, Dr. Lim. Welcome to our seminar. Thank you so much for taking time out to talk to us. Let's put our hands together for Dr. Lim.
Okay, thank you, Eddie, for those kind words, and of course, thank you, Mr. Lim, the president of MPMA, for inviting me to do this presentation. It's really a huge honor to be speaking to your members as well as many people whom I've invited to come to this. I understand the urgency. I mean, being thrown the rules like this. But fortunately, we actually have been doing this for many months now with a variety of factories. Many factories, in fact, want to adopt this particular method to prevent, to prevent COVID transmission in their particular factories and workplaces. So I'll take you through our next place, Sujata. I'll take you through this evening. This is a picture of how we've been doing this for all over Malaysia now for many factories. So I hope one day some of you may sign up for this, even if perhaps under somewhat dire circumstances when MITI require to comply with this. But really, it's something really good, I think, that you should consider doing, regardless, I think, of whether MITI requires or not. Next, please, Sujata. Now, I'll take you through quickly on the background. And then, obviously, I think it's good to have some background knowledge about how to prevent virus transmission. And, of course, screening tests just being one of them. The one that I'm going to talk to you about, obviously, is going to be high-frequency mass screening. So we don't just talk about screening, we talk about high frequency. And I'm surprised that MITI actually came up with the idea of twice a week. Well, that's high frequency enough. Some countries do 3 times a week. In fact, there are factories that we have worked with, they do daily screening. So I'll explain more of the science behind that, about the frequency of screening later. And finally, obviously, some ideas about implementation. I know most of you will have questions about implementation. How is it done? How can the workers be trained to do these tests? You want reports, you want records to show enforcement, so on and so forth. I'm sure you have 1,000,001 questions and concerns. Yep. I'll take you through the presentation quickly so that we have more time for Q&A later. Next, please, Sujata. So this is what's happening in Malaysia now. Okay, so how can we do better? Next, please, Sujata. And to some extent, really, I think this was entirely predicted. This is data from Singapore. And Singapore, like us, have a lot of migrant foreign workers. And when they had the last outbreak, some of you will remember Singapore had a very bad outbreak in April, May last year. And they ran a huge survey, a huge testing, a huge mass testing on all their foreign workers. And they found that more than half their workers were infected. That's pretty amazing. Right? More than half their workers in Singapore were infected. I'm talking about foreign workers here. And interestingly, 80% of them were completely without symptoms now. Not having symptoms is a major issue and very relevant to screening, which I'll tell you more about later on. Next, please, Sujata. And then, sure enough, obviously, you know all about it. 60% of clusters from factories and construction sites, that's Ministry of Statistics. And obviously, sooner or later, we begin to see the same thing all over the country, clusters popping up everywhere, here and there. And next, please. And then you remember on the 1st of March, the government decided to reopen schools. And sure enough, what happened next? Next, please. I think slightly over a month, schools were closing again because the clusters now start appearing in schools. So whenever you have a lot of people coming together, and we call it congregated setting, right? Whether in schools, in dormitories, in workplaces, something like this can happen. Clusters can happen. Next, please. And the science behind it is not really that complicated to explain, and that's something to do with what's called network. Okay, transmission risk as a result of network, right? So you have on the right-hand side under case B there, you have people, an infected person is in red color, and they happen to live in or work in congregated setting. And what happened is that quickly it was spread. So that has been shown fairly clearly that if you're going to allow this to happen, the people coming together, transmission risk automatically goes up through the roof. Next, please. So there you are. How do we prevent this then? Specifically, how do we prevent this in congregated setting like workplaces or in schools? Well, there are basically 5 ways: restriction, minimize surface transmission, minimize airborne transmission, vaccinate everybody, and of course, the one we want to talk about today, screen or test everybody. Next, please. And this is what we have been doing the past 2 months. Unfortunately, not terribly effective. I'm actually quite surprised that the current lockdown has been taking so long to show an effect. Well, maybe I'm sure some people are now working on why is that so much. Anyway, restriction works, lockdown works. It's just that I don't quite understand why it's taking so long. Next, please. The next one, obviously, is what we thought was how COVID-19 is transmitted, and that's through what's called touch contamination or surface transmission, right? Someone coughs, someone sneezes, and then all those things drop onto the ground, or drop onto the doorknob, or drop onto the table. You use your hand to touch it, touch yourself, and then you contaminate yourself because of touching them. Well, it turns out that that's not actually quite true, unfortunately. I know we do a lot of hand washing and so on and so forth, and we decontaminate places. It's probably not terribly effective. In fact, it's proven now. Next, please. Most transmission, I would say probably more than 90% of transmission occurs through the air. So COVID-19 is largely an airborne disease, right? It's an airborne transmission. So someone coughs, you're close to somebody, and then it gets transmitted to you. And then the preventive measures for this kind of airborne transmission is actually quite different from touch contamination or from surface transmission. So, but we're not here to talk about this today. Next, please. And then given that, obviously, it makes sense to wear a mask. To wash your hand, in fact, if I were you, you might want to start thinking about washing your nose, which is desanitization. I carry this everywhere I go now, put it into your nose, and spray into it, and desanitize your nose. That makes a lot of sense, actually, because if it's going to come through the air, rather than come through your hand, and to come through touch contaminations, you want to be sanitizing your nose. Watch your distance, no close door, no close contact. You know all about that. Next, please. Now, the next thing you could do, of course, is vaccination. I hope all of you have got the vaccination. I got mine many months ago now, and I think that's important. So I don't want to dwell on that. Get your vaccination when you get a chance. And I'm so glad now the government has really quickened the pace of vaccination. We're doing almost like 200,000 a year now, 200,000 a day now. That's pretty impressive results. Huh? That's pretty impressive for a small country like Malaysia. So I'm really glad that the government is finally doing something. Next, please. And the next thing is what we want to talk about. High frequency screening. So I'll quickly, briefly explain some of the science behind it and then go on to the practical implementation now. Next, please. So the idea is quite simple, right? You got one guy who's infected, or who's infectious. You want to stop him. You want to stop him from entering a factory. And how do you do that? Sorry, I gotta put it on silent mode. Give me a moment. Give me a moment. Okay, now there you are. Well, many of you actually measure temperature, right? Measure body temperature. Every factory I go to, I've been going to a lot of factories lately, yeah. They measure my temperature. And I often wonder, does that really work? Well, a better way actually of testing instead of testing your temperature is a test whether you are shedding virus, whether it's virus coming out your nose. Yeah. And there's a way to do it. That's called a screening test. I'll show you later on. Next, please. And the science behind it is really quite simple. On the y-axis here, okay? On the left-hand side, there's a y-axis. That is the amount of virus being shedded by someone who is infected. On the x-axis below, it's from time 0 when it's infected, and then over time, obviously, the virus shedding increases. The green line referring to people who are pre-symptomatic. The orange line refers to people who are completely without symptoms. And you can see that the peak shedding of virus, the blue line, the blue arrow, occurs before the red arrow, where you have peak symptoms, like when you're having a fever. And that's exactly the problem. Most transmission occurs from people without symptoms. We know that from Singapore data, 80% of them. And the rest of it occur from people who are without symptoms yet. They will eventually have symptoms, but most of the shedding occur before they even develop symptoms. And that's exactly the problem why COVID-19 transmits so fast, so quickly. Because it's largely transmitted by people like you and I who are completely well, who have no symptoms. Next, please. And that, if you understand that graph, then you can understand there are basically four types of spreaders. The red line refers to people who are super spreader. These are the guys who shed, who discharge a lot of viruses soon after they're infected, and they share it with the rest of the world. That's a dangerous guy. That's a guy you need to stop at your doorstep of your factory, okay? And then the green line are people who are pre-symptomatic, the orange line are people who are asymptomatic, and then of course a nice guy like me who are vaccinated. We can still be infected. Vaccinated person obviously can still be infected. But however, after infection, we tend not to share our virus with other people. We tend not to transmit because our immune system fight the virus and kill it off, right? So we have very low viral load, and therefore we tend not to shed a lot of virus after being infected. Next, please. So mass screening works. No doubt about it. If you understand what I've tried to explain the science, so I'll share with you some data. Okay, it gets a bit technical, but never mind. Nevertheless, I'll go through this very quickly. Next, please, Sujata. Now that's data on frequency of screening. On the x-axis, you see if you don't do any tests, you do daily testing. You do testing every 3 days, which is what BT is telling you to do now. 2 times a week is every 3 days testing. Right? And you do weekly testing. You do every 2 weeks testing, and you can see obviously. On the y-axis, that's percent of infected after entry of one infected case. So you have one worker coming to your factory and is infected. If you do daily testing, you can almost completely avoid your factory being infected or having an outbreak in the factory. However, if you do less frequent testing, something bad is going to happen to your factory. Next, please. This is data coming from nursing home, not so much from factories, but that's the best we have so far. And it tells us that 2 things. Number one, outbreak occurring in your factories or in a nursing home largely is driven by two factors. Number one, the community transmission. The factory is located in a super red zone. The R0 is very high. A lot of transmission is going on in the community. Sooner or later, some of that transmission is going to go into get into your factory. And the second factor, screening. If you don't screen, people are going to enter your factory who are infectious and start spreading among your workers. So the graph on the left-hand side there, the A graph there tells us on the x-axis, the daily probability of staff being infected. So that's the community transmission, right? How much transmission is going on in the community and your workers then come into your factory. The y-axis is the probability of an outbreak. So as you can see, less frequent testing increases the risk of an outbreak. But at some point, if the community transmission is so high, no amount of screening test actually is going to work. Okay, so that's something you need to bear in mind. Screening can work, but it can only work so far because if there's so much transmission going on in the community around your factory, some of that eventually going to get into your factory. Which then brings us to the second point, which is that when we do screening, number one objective is we don't want an outbreak in your factory, right? But sometimes that cannot be avoided because there's just so much transmission going on in the community where your factory is located. Then in that case, the outbreak is going to happen. Okay, one guy, two workers are going to be infected sooner or later when they come to your factory. What you don't want is a big outbreak, right? So it's important to limit the size of the outbreak. And that's where I think screening test really comes into its own. With high community transmission, some infection is going to come into your factory. Then your job is to try to minimize the outbreak. It's okay to have 2 guys, 3 guys infected in your factory over a week. But it's bad news. It's over 2 weeks, half your workers are infected. I've seen factory. Okay? I've seen factory where 99% of the workers are infected. Okay, so so you have a major big outbreak. That's it. Your factory is shut down for the next 3 months. So if you cannot avoid an outbreak, you want to be able to minimize the size of the outbreak, and that is where I think screening test really works. Okay, the red line there, incidentally, you see a red line there? That's the amount of transmission that's currently going on overall in Malaysia. So it's no longer low. In fact, Malaysia has some of the highest transmission now in the world. So I think this is important graph to understand that we want to minimize the risk of an outbreak, yes, but if that happens, we want to limit the size of the outbreak, and screening can't really work there. Next please. So because it works, many countries are doing that now. In the US now, they're doing 3 times a week. The government is dishing out test kits to people and tell people to test at home. Next please. UK, of course, some of you may have heard, they're doing twice a week testing now. I don't think we can afford it in Malaysia. The Sri Lankan government, Penang government, next please. I mean, they try to do screening in the community, but it's just a one-time thing, right? So one-time thing, I don't think it's going to work. If you want to do screening, do it frequently and do it on the mass scale. Next please, and of course, unfortunately, meeting our requirements. And we have, of course, been doing it in many factories now, even long before MITI has these new rules. Next please. So to explain the testing now, so let's come back now to, I'm not going to explain the science behind the test methods now, because I'm sure you have millions of questions to ask about RTK testing and soft and all that. On the left-hand side, the blue box there, we talk about diagnostic testing. So that's what the doctor does, right? You go to a doctor with symptoms, with fever, or you come to recent contact with some people who are infected. Your doctor is going to suspect that you may have COVID. He runs a diagnostic test. And the best diagnostic test, undoubtedly, is a PCR test. On the other hand, if you are just simply testing people, okay, regardless of symptoms, regardless of contact history or exposure, we are talking about screening tests now. When you do a screening test on millions of people, or thousands of people, or hundreds of workers, okay, then the requirement of the test is a bit different. In fact, drastically different, which I shall explain in a moment. Next, please. So we keep coming back to this graph because this is an important graph to understand. Remember, the objective of screening is to identify infectious people who are shedding virus. And that's in the blue window there. Okay, that's when they are after they're infected. The objective of screening is not to diagnose whether people has COVID-19. That's an entirely different objective, a different purpose of testing. Next, please. So given that we want to know whether someone is shedding virus instead of whether he has got COVID-19, actually, PCR is an overkill, right? Antigen tests, in fact, correlate much better with virus shedding. Next, please. I'll show you a comparison between PCR and antigen testing. RTK refers to antigen testing, right? PCR is probably what you know now. That's what lab does. And the reported cases every day you hear from Ministry of Health, that's based on PCR confirmed cases. You will see that on this, from this table here, if you compare RTK directly against PCR as a standard, as a reference, you're going to get about 75%, 70% sensitivity, which means 1 out of every 4 people who are infected that you test, you're going to miss them. Now, you may say, okay, that's a bit scary. I'm missing 1 in 4 people. However, if you say, I'm not interested in whether they have PCR positive. I'm interested in whether the person is shedding virus. Remember, the objective is to find out whether he's shedding virus. You'll find that antigen testing is almost as good as PCR. Why is that? The reason being, in fact, that PCR testing often are picking up people who are already recovering from the virus, from the infections. And when you're recovering from infections, you're not shedding virus. You're shedding dead virus. And dead virus still has RNA in them. And PCR will pick it up. Okay? And that's the issue. So if you do testing at one point in time, RTK antigen can be as good as PCR. However, we're not doing one time, right? Next, please. In fact, we are doing it frequently. If you do PCR testing once every 2 weeks and you do RTK testing every 3 days, RTK testing will pick up all the infected cases long before PCR. In fact, once every week or once every 2 weeks, PCR testing is not going to save your factories. You're still going to have people who are infected coming to your factory for 5-6 days, transmitting them around before the PCR pick them up. Frequency matters, and this graph shows that, right? That the frequency, the efficacy of minimizing transmission in your factory reduces drastically the moment that you increase the frequency of the testing to once every 2 weeks or to weekly. Ideally, obviously, do daily testing if you can afford it. Next, please. The other important factor is not just frequency of testing, but how soon do you get the results? So you can, some of you may have PCR tests done before. The guy swab you, put it into the little tube with VTM medium, sent to the lab. The lab probably take what, 24 hours, 48 hours to report to you. So what can you do to affect worker? I mean, the guy is waiting for his result. You don't know if it's positive or negative. So the moment you have delay in reporting results, your screening program is going to suffer. Okay. It's important to pick a test that provides a result instantaneously on the spot. Next, please. So if you understand all that, these are all the test methods. And on the right-hand side, the blue one, the samples that we have. Well, quite frankly, there's only one choice: RTK antigen tests. Luckily, the BT is not telling you to do PCR testing. Okay, that will probably bankrupt you. But on the other hand side, there are a variety of samples, and I'll tell you more about samples. Basically, you're down to only 2 choices. Either you take a nasal swab or you take a saliva. Next, please. So, having said all this, what do we want out of a test for screening purpose? Not for diagnostic purpose, but for screening purpose. Number one, we want it to be feasible. It must be something that you, as SME, as an employer, can do. No point asking you doing something that is not possible for you to do. So the test has to be simple, has to be safe, has to be low cost, has to be low resource, no expensive equipment. You know, a PCR equipment will cost $500,000 ringgit. You can't install a PCR equipment in your factory to do screening. And it must enable on-site self-testing. So the workers come to your factory on-site and then do the test, and that's it. Okay. There's no people coming around and swabbing him and putting the swab in some tube and sending off to a lab, and then everyone's just sit around and wait. It doesn't work. Okay. It has to minimize workplace disruption. Your workers come to your factory to work. He doesn't come to your factory to get a test. He comes to work. He get the test done quickly in 5, 10, 20 minutes, and then that's it. He start work. That's what a factory is for workers to come to work. Factory is not a place for workers to come to get tested. I think it's important not to get confused with that.
Agreed.
The second thing, obviously, is accuracy. The test must be sensitive enough. We don't want a test that completely misses people who are shedding viruses. And sensitivity, besides the test method, can be improved by serial frequent testing. So frequency of testing is critically important here. No matter how accurate a test, PCR is very sensitive, 99% sensitive, but you do it once every 2 weeks, is useless. Frequency matters a lot more than sensitivity, actually. I shared with you the data earlier on. And next, obviously, it must be actionable. So if I do the test, I need to be able to act on the results. And actionable require that the result be available on the spot so that you as an employer make a decision. Enter or do not enter my factory. That is critically important, all right? Next, please. So given those requirements, really, so if you ask me what test and how frequent, well, RTK antigen on deep throat saliva or nasal swab, at least twice a week. I'm really glad that MITI got it right. So they must have someone advising them and say, okay, you're going to do mass, you're going to do workplace or factory screening, use RTK antigen, do at least twice a week. So they got it right. Okay, next please. Now, what about the swab? So he mentioned something in the rule that says swab. So I thought I put in this slide to explain to you. Okay, I won't go into detail. There are many ways to swab someone for a sample. The first three is not something you can do because it's not for self-testing. You require a trained, certified professional, healthcare professional to come to your factory and swab your workers. That will probably take what? Maybe you're a small factory, you got 50, 100 workers, that will take half a day. So your workers standing around waiting and doing nothing, waiting to be swabbed for half a day, that's a no-no, right? So really, 4 and 5 is your really, 4, 5, and 6 really are your only option because those samples allow for self-testing. Your workers can collect the samples themselves and then go on to conduct the test themselves. That's very important attributes for a screening test, okay? And the last one is mouthwash, I won't talk about that. So there you are. There are many possible samples, many possible swabs to do. I'm not clear at this moment what MITI wants. Maybe they want saliva, maybe they want anterior nasal swab. But if they want nasopharyngeal swab, which means they require a professional to come to your factory twice a week and swab everybody in your factory, I don't think that's feasible, okay? Next, please. Now, self-collected deep throat saliva or nasal swab or both? That I think should be the answer, okay? And the research, in fact, was done in IMR in Malaysia, and the government ministry has gone on to approve the use of deep throat saliva. And if anyone still has any doubt, there's this very good study from Singapore. Remember, Singapore had thousands and millions of migrant workers like us, and they run this huge study, and they compare nasal swab versus saliva and versus nasopharyngeal swab and blah, blah, blah. And it turns out that deep throat saliva is perfectly adequate for them to use in screening millions and thousands of their workers. Okay? Well, if it's good enough for them, I think it should be good enough for us. Next, please. So there you are, having gone through some of the science behind it. Okay, and I hope you enjoy. I mean, you like that and you understand that. Then let me tell you something about implementations are, because at the end of the day, this is probably what concerns you: the day-to-day implementation of screening at your factory. Okay, we need a lot of training, right? Motivation, behavioral change, the new norms now, the fact that people get tested now at the factory, twice a week. There needs to be ongoing oversight. My medical team will be there with you. Then sooner or later, you're going to have positive cases. You're going to find some screen positive cases, but that's the whole idea, right? Pick them up early. And then how do we manage that? And of course, finally, quality monitoring and research. I'll tell you more about the research. Okay, next please. So these are the stuff you need. The RTK kits here, you're going to buy them. Well, you can buy it from the test distributor if you like. Now we just provide it to you as part of the program. Okay, and then this for saliva container, and then of course biohazard bin to dispose of all these things. Next, please. And then you need the workers need to be trained on 2 things. Remember, your workers conduct the test himself, so he need to know how to do deep throat saliva collection, or otherwise how to do nasal swab. Okay, I'll show you in a moment. And then, of course, you need to be able to conduct a test using the kit. All right, the kits you'll be purchasing, and you're going to conduct this test on arriving at the factory. And lastly, obviously, that all this test results need to be recorded somewhere, need to be charted somewhere. I'll show you how we do this. Next, please. So there you are. The technique for deep throat saliva collection, very important. Okay, a big important part. That's something that workers need to learn how to do this correctly. Next. This is some pictures that we'll be sharing with you, and then we were training your workers, and then your panelier and supervisor will be going around and checking that the workers are doing this correctly. Next, please. And this is nasal swab. So you're going to swab and then you swab. So you can swab your nose yourself. You cannot do a nasopharyngeal swab yourself because it goes quite deep inside and you can hurt yourself. Okay, that's why you need a professional to do it for you. On the other hand, an anterior nasal swab is something you can do yourself. Okay, so it's possible to do self-swabbing. Next, please. And then the test itself. So we'll take you through how to conduct the test and so on and so forth. Next, please. And of course, eventually, you're going to see the results. So positive, negative, invalid results. We'll be taking you through and how to interpret the result. Result that can be very slight to very deeply positive, 1+ positive to 4+ positive. Next, please. And then sooner or later, you're going to have issues like, is it false negative? Is it false positive? You're going to have people coming with intermittent false positive. You're going to see all this thing, and we are there to help you as your medical advisory. We will tell you. In fact, there'll be a group set up. The HR will be texting us. We tell them, okay, do this next, do that next. Okay, next, please. And of course, remember, you don't want an overly sensitive test. An overly sensitive test pick up everybody, but it will give you a lot of false alarm. Okay, you're going to have workers every now and then become positive, and then everyone get a bit jittery about it. On the other hand, you don't want a test that's completely insensitive. You're missing all the cases. All right, so having a good test strategy in terms of trying to balance the test sensitivity is very important here. And obviously, we'll be advising you how to do that. Next, please. And then, of course, I won't explain all this. We'll do this another day. Next, please. And then, of course, test positive result. Okay, that's when it really struck the fear in your HR. I got test positive today. Okay, so it can be false positive, it can be weakly positive. Of course, it can be truly positive, and you're going to be seeing all this. Trust me. Next, please. And then comes finally how to chart the results. So we get asked this question a lot of times now. Number one, of course, you can do a manual record. So the HR has a record set up. Just as people coming to your factory, you measure the temperature, and someone may record the temperature. So now you just record the test result, positive, negative, invalid. In fact, no such thing as invalid. If an invalid result, you repeat the test. There is the digital records. So what is called My CMSS. So your staff will be trained in how to transfer the result into a computer system so that you now have a digital record. Okay. All these are FOC. In fact, it's not FOC. The $100 you pay for everything. Okay. Pay for my consulting services, pay for the test kit, pay for this computer system, pay for everything. You may wonder why it's so cheap. I'll tell you that later on, okay? And of course, some of you may want a SIM card report. Remember when you go and see a doctor, you go to a lab, they give you a report. That report came out of a database called SIM card, okay? Every test done in Malaysia, the result has been reported into a database maintained by MKK called a SIM card database, and then it churned out this report for you. If you guys insist on having this report, it's fine with me. Just pay for it. It's very expensive, okay? It probably costs about several $100 more per worker per month, okay? So this is an example of what it looks like if you use a digital record. So this is in fact, this is in fact result from yesterday, I think. So we have this factory somewhere. I won't mention the name of the factory. In fact, it's all blank out. You won't know the name of it. So this is what the HR see, okay? Your HR see the records of everybody on that day who were tested. And there you see, this guy was tested positive, right? On that day, one workers out of many workers in that particular factory was tested positive. You get to see the result. In fact, you get a notification on your email as well as probably on your SMS. Next, please. However, the workers himself. Next, please, Sujata. Yeah. This is all the test record for one individual worker. Remember, your workers come and get this thing done Monday, Thursday, and there you see from at the bottom there is in May, and it goes. This is all real records from real factories that we've been doing for many months now. And then this guy was tested positive yesterday. So you notice that in the blue box there, and you probably can't see it, it says photo of test result. So your workers actually capture a photo of the test kit, okay? So we have, next please. And that's how it's done. So we capture the photo, we capture the packaging because we can see the serial number and the manufacturing batch number. And this is allow for verification. So you're probably thinking, what if my workers start cheating me, right? They don't do the test, they just simply walk in, throw away the kit and go to work. Well, the picture allows us to verify whether the result is correct or not, okay? It's true or not. Next, please. So there you are. So there are all these records that you will have, and the enforcement officer come to you. You just show them the records. Yeah, I've been dutifully doing all these tests on all my workers. You can see the result yourself. You don't believe the result, you can go and verify the result yourself. No problem. Okay? And this is, you have to organize now. Your work site now has to be organized in a way to conduct testing. Your workers arrive in the morning. There's a place where they go to with appropriate social distancing, and they do the tests. Next, please. And of course, you need to have some kind of campaign going on. The HR has to do that and get people motivated to want to do testing. Yeah, next place. Nobody cheats, right? Besides testing, obviously, we also come and conduct what we call a COVID-19 risk assessment. How much risk are you having? I mean, how much risk do you face as a workplace, as a factory? Yeah? And we go through all this with your HR. to do a risk assessment. Next, please. And obviously, we want to understand something about local epidemiology, how much transmission is going on in the location where your factory is. Next, please. And in fact, we will encourage you, we will urge you to seriously consider seroprevalence, which means we do a simple blood test on all your workers, day one. All right, we call the baseline. And if we see like 30 or 40% of your workers were infected, you probably are in a very serious, you probably are facing a fairly serious risk. We have factories where 0% of the workers were infected. So we knew from day one, this is a good factory. We have done a lot of right thing to protect the workers from being infected. And we have gone to factories where more than half the workers were previously infected, and we knew, aha, that's a high risk place. In fact, we probably tell our people, don't go to that factory too often. No. so you might want to consider doing that. It's very cheap. I think it only costs about what, 15 ringgit or so to do this one test. So the doctors will come and teach you how to do it. This is a blood test. This is not an RTK antigen test. Next, please. And then, of course, we also do this. Remember, in that red circle there, frequent screening test is only one measure, albeit a very important measure, among a whole comprehensive set of measures that you should be implementing in your workplace. We will sit down and go through and review the SOPs with you, and perhaps provide some suggestions as to how some of your SOPs can be improved, or perhaps measures that you've not considered. Some of the measures that have worked really well in some factories that I've seen. Okay, 0 infection history among all workers. I mean, that's impressive to me. Okay? So you may be able to learn from them as well. How do they protect their workers from being infected, especially if they come from a region, an area, in a location where there's a lot of community transmission. Next, please. Okay, so this is my last slide. So this is one thing I want to remind you. When you sign up for this program, you're signing up for this research. Okay, let's be honest. Let me tell you straight, all right, in the face. There is a research protocol approved by the Ministry of Health. In fact, it's conducted together with a lot of Ministry of Health science officers and medical doctors. And it's called Effectiveness of Mass Screening in Preventing Workplace-Related Clusters. Remember, the Ministry of Health is very concerned about workplace clusters. So this research came about to encourage factories, owners, employers to participate and then share data with us so that when we do screening, we have a means of evaluating whether mass screening, which comes at some cost, right? Whether it's truly effective in preventing clusters. Now, many of you will probably say, and for many of the factories already doing this for many months now, they probably say, yeah, it works, because so far none of the factories that we've been doing ever had an outbreak. But that's not good enough for us as scientists, okay? As researchers, we want hard data. So one of the conditions for you to sign up for this program and therefore get this testing done so cheaply, because let's face it, it's subsidized, is because we want you to share data with us. Okay, so I'm going to be upfront here with you. You are signing up into a research program and not just a screening program per se. Okay, you don't want to share data with us, you want to keep all the data to yourself, fine. Don't sign up for this program. Okay, get someone else to do it for you. Thank you very much. I think that's my last slide. I'm glad to take any questions.
Wow. Am I on, Sujata, now?
Yes, you're on. We can hear you.
Okay, thank you very much, Dr. Lim.
Thank you.
That is mind-boggling. Probably can spend another 2 hours if you go into all the details, but I think that's enough. As a science student with an engineering background, I think I can understand most of it, the flow of things, but not the details. Never mind about that. But the long and short of it is that frequent screening is good. It works. It prevents the clusters from spreading, and twice a week seems to be kind of the cost-effective median. You can do it once a day, but it's going to cost a bomb. So our members, please take note. And also, you have got very good results so far. Okay, there are questions. Dr. Lim, let me get to my...
Mr. Eddie, sorry, I have unmuted everybody.
Oh, okay.
So at this time, they can either raise their hand and speak out the question that they have for Dr. Lim, or they can type it into the chat box.
I think we'll take the questions from the chat box first, clear that out, and then go to the verbal questions, shall we?
Okay.
Somebody has asked first question, 100 ringgit per test, Dr. Lim?
100 ringgit for 8 tests a month, yeah.
Ah, now we're talking.
plus medical advisory services, plus the application, and we throw in a lot of goodies because we want to encourage you to sign up and therefore share the data with us for us to publish that research eventually. Okay.
I think you mean all inclusive of the medical support and all that too.
The whole works, yeah. The whole works, yeah.
Not in addition to that, you're gonna pay. So that's good. That's first question. So please, those of you who are not speaking and asking questions, can you unmute yourself? Otherwise, we have a lot of people, you know, with inputs, and then we won't be able to hear the answers. 269 of us log on now, so please mute yourself. Okay, second question is, my staff tested with RTK, but for and also for PCR. So was discharged from quarantine center after 2 days. PCR was supposed to be more accurate, but is this an example of false positive? Why was he discharged after 2 days only?
Because they run out of space in the quarantine center, yeah.
Really?
Yeah, of course. Sorry, CAC, you know, COVID-19 assessment center.
Yeah.
They are now allowed to actually grant you for home quarantine, simply because at the peak, in fact, even currently, many quarantine centers is pretty full. So when they run out of space, the category 1, the lowest risk people with infection, they tell you to go home and put on the thing and tell you to stay at home. So you're on home quarantine order. They issue a home quarantine order and you have to stay at home instead of putting you up in the quarantine center. Yeah.
Okay, thank you for that. Third question, Sabrina says, do the test kits have an expiry date?
Oh yeah, they do, of course. So when they expire, you just return to us, we return to the manufacturer. Remember, we are not seller or manufacturer of test kit, okay? We buy them like you.
Yeah, so I think, to be fair, Doctor, I mean, if you come with your team and give us the test kits and for the month, I don't think you bring test kits that are going to expire in 2 weeks.
No, of course not. They're going to expire probably 1 or 2 years from now, yeah.
Okay, that's not going to be a problem. And then the next question is, 1 month usually have 4 weeks. How many of that month we have 5 weeks? How would you calculate the fees?
So what's happening is that for companies who sign up for on a monthly basis, which is counted as 4 weeks, and then there are companies who sign up for 3 months. Then if you sign up for 3 months, you don't get 8 times 3, 24, right? You don't get 24 tests, you get 26 tests.
Okay.
And you pay the same price.
Okay.
So over 3 months you pay 300 ringgit, right? Per worker, but you don't get 24 tests, you get 26 tests now.
Okay. Yeah. So unfortunately, I only signed up for 1 month. I should have taken 3 months.
You may change your mind next month, no? Because meeting might change the rules, right?
Well, let's
yeah.
the classes come down. Another question: if currently our company have working schedule based on rotation weekly, for example, staff A come in this week, staff B comes in next week, do they still need to do swab tests for twice a week, or only on the week that they are scheduled to come? That's a good question.
Yeah. Basically, when we say a worker needs to be tested twice a week, we're referring to the same worker, right? If he comes to your factory 7 days or 5 or 6 days a week, he needs to be tested twice in that week. Okay. On the other hand, because of the 60% workforce rule now, some of your workers may only come once a week, some may not come, you know. So under those circumstances, they get tested every week, every time they arrive at the factory.
Oh, okay.
So it doesn't mean that because I only come once a week, so you know, then if this guy only get tested every other week. No, it doesn't work that way. Within that week that he's arrived and he only arrived once, he get tested once. So effectively, he's getting weekly testing. Yeah.
So I think when you sign up, the person who asked the question, Sabrina, you talk to Dr. Lim and his team about the intricacies of the testing and so on. Rather than answer that question here. So I would think that it's safer to still carry on the 2 tests a week, because the other guy might get it from outside and then next day he turns up for work without getting tested and he's positive, then you have a quandary, you have one worker less for that day or 2 workers less for the day. So anyway, that's my little input. Question 4 from Ho in KL. Can we get an official offer for the package, Dr. Lim?
Yeah, just write to the company and they give you a quotation. Yeah, please. Let's not discuss quotation issue here. I mean, I don't deal with that. Yeah.
So afterwards, we shall need you to give us the contact of the company who actually whom you're working with. Yeah. Okay. Sean Lee, question 5: Does the employees or the employers must be competent in getting training to conduct these tests to the workers?
Yes, of course. So it comes in 2 parts. The first part, obviously, we will be there to conduct a training, primarily targeting your HR and your superior, your supervisors. They then in turn train the workers, unless of course your workplace is so small. So while they're training your workers, we have a doctor who will visit you from time to time to conduct an oversight, to make sure that these guys are obviously doing the test correctly and so on and so forth. In the first 1-2 weeks, you're going to report a lot of issues with us. If you don't see a test result, like this, like that, so you're going to get some of the technique wrong. Okay, so we will iron out all the technical issues with you, typically over WeChat, over WhatsApp. Otherwise, we have a Zoom meeting, and finally, if need be, the doctors will go and visit your factory. So you have someone to call upon anytime. Okay, yeah.
My additional question to that is, Dr. Lim, is that going to be a 2-time affair? First round you come, for the training first, and then another day start the testing, or on the same day you start the testing, you do the training first, and then straight away go into the testing?
That entirely depends on how urgent it is. I have factories where they do the training in the morning, and in the afternoon they test everybody in the factory. Yeah? So they were obviously just recovering from an outbreak, so they're really quite jittery about it, And then there are some who are more relaxed about it. They do the training, and maybe 5 days later they start the regular screening. So that's entirely up to you to decide.
I'm surprised. I think with the MKN SOPs, I think most of us are desperate to get it done on the same day. Okay.
Yeah.
Next question, Chi Sing Wong. SOP aside, assuming everyone in the factory is vaccinated, is the test with this frequency still necessary if everybody is vaccinated?
So you are right, because like I said, I mean, 2 times a week testing should not be cast in stone, right? It should be science-driven. I mean, it should be science-based, right? If everyone is vaccinated in your factory, you probably don't need to do twice a week testing.
Okay.
You probably can get away with once a week testing or even once every 2 weeks testing. But remember, it's probably pretty hard to get everybody vaccinated in the factory. Sure. So then you're going to have issues about those who are not vaccinated. They certainly have to come and have regular screening.
Right.
Do you exempt then people who are vaccinated? My recommendation, my advice is probably not, because you want it to be part of the culture. It's part of the culture of the workplace now that people get tested from time to time.
Okay.
Yeah.
We're nearly halfway through our question. We have 15 of them so far. I can see this is going to be question number 8. For those who already completed 2nd dose vaccine, do they still need to be tested? I think you've answered the question.
Yeah.
Question 9 then, Kam Weng Tam says, you mean 100 ringgit per packs basic package still available, or sign up now, or need to go for a higher package?
Can you discuss it with the company? I'm only the medical consultant here. Yeah.
Okay.
I think they run out of stock. I think they run out of the stock for the cheap package.
Yeah. When you contact the person, you can go to that detail. Soma Naidu say that, is it mandatory for tests and employee 2 times a week? I'm just reading out the English.
Yeah.
So is it compulsory? Yes, I think mandatory, because this MKN SOP says that the electronics sector, all the factories must be tested twice a week. I think we go to number 11. Kit from Polymax say, are the results from this test kit valid in MITI's EMTO requirement for 2 times a week swab test?
Good question. Obviously, like everybody else, like you, we also buy the kits from a distributor, from a test distributor, and obviously, all tests sold in Malaysia have to be approved by MDA. You remember that, right? So they are MDA approved kits. If MDA think that they are accurate enough to be sold in the market, then so be it.
Okay. Thank you. Question 12. Travis Tan says that, would you advise 100% screening on twice weekly is better, or a daily rotation basis of 25% of the workforce, meaning complete 100% after 4 days?
Not a good idea.
No?
basically everyone get tested every 3 days, right? At a 3 days interval.
Yeah.
Now, how you arrange that is entirely up to how your factory is organized, because there are shift work, there are people coming work in the afternoons, there are people coming back work in the morning. You just have to make sure that everybody who comes to your factory, they get tested twice in 1 week.
His concern is Dr. Lim, Travis' concern is that he doesn't have enough space around the factory to get everybody tested, at the same time. What would be the suggestion to solve that problem? Space problem?
I've seen some factories with very creative solutions. So what they do is they use the back lane, they put out some canopy, and then people get tested under the canopy before they even enter the factory. So there are many creative ways for you to go about creating the space to make it possible.
Or if I may suggest, stagger the time of the worker turning up so that you don't get all 500 of them at the same time. So discuss with the team. I think once you've booked the testing or screening test, so that I get them every 15 minutes. So many come in and so on. That should help, I think. Okay, Travis. Question 13. Liang Junwang says, what's the difference between the RTK antigen test done by hospital, clinic, lab, and this saliva RTK antigen test?
The test kits are the same, and for hospital use or lab use, they don't want to use saliva because they have someone to swab you. So the kits are the same. What's different is the sample use. So for hospitals and lab, they use swab instead of saliva, for very obvious reason, right? Because you need training. There's a technique to collect the saliva, and someone showing up in a hospital or in a lab, he has never been trained how to collect saliva. And so how do I collect saliva from you? It's not just you spitting out the saliva. You're going to find out soon when you go to your factory to teach your people how to do it. There's a special way to collect that saliva that's important. So obviously they just stick something in and collect it for you.
Right.
And of course, charge you for it.
Okay. And then question 14 here, Alan Tan says, in this package, which type of tests are we signing up for? Is it saliva or nasal?
It's up to you. You can choose either one. The data shows that they are as good. In fact, the data shows saliva is actually better than nasal swab. But regardless, you choose. You want to take nasal swab, you do nasal swab. You want saliva, you do saliva. Half your workers can do nasal, half your workers can do saliva. We are not partial to that.
Okay. The question arising from that is, Dr. Lim, if we do nasal test, then somebody has to go and put the thing into our nose.
Okay, so there was a slide there, but I think I go over the slide too quickly. There are many types of nasal swab, right? There's a nasopharyngeal swab, there's a mid-nasal swab, there's an anterior nasal swab. So there are many types of nasal swab. One type of nasal swab you can do yourself. You don't need a health professional to stick something into your nose to do.
So does that need to be clarified when the guy books your team to come in to do the test beforehand?
The kits come with a swab. So then you decide, okay, I want to do the swab on the nose, or I want to do the swab on the saliva. Entirely up to you. We teach you both techniques. Yeah.
So there's freedom of choice there too. Very good.
Eddie, before I go to that, Dr. Lim, I just want to ask this question, just as a follow-through on the question there. Between a anterior nasal swab and the saliva swab, you can obviously see that the saliva has been expelled properly if it's done properly.
Absolutely.
The anterior nasal swab, if a worker is either lazy or if the worker doesn't want to get the positive test, we may not be able to assess as to whether the nasal swab has actually come into contact with the anterior part of the nasal. So, would that be a possibility of a problem there between the two types of tests?
That is true. Dr. Lim, I'm glad you are so observant. Yeah, if a worker wants to cheat, right? Taking a swab and doing it is easy to cheat. It's harder to cheat on saliva because you actually have to go through the entire motion, and having the saliva comes out into a container that's observable. Okay. And secondly, obviously, going by the data, the data actually show the saliva test is superior to nasal swab, and that has come out in many studies now. But nevertheless, nasal swab is still an accepted method. Both methods are capable of self-testing or self-collection. The workers can be trained to collect this. Workers cannot be trained to collect, say, a nasopharyngeal swab. It's too dangerous. Workers can be trained to take an anterior nasal swab, like we see in Mr. Lim.
See, Dr. Lim, I told you the limbs are smart.
Yeah.
Okay, next question. Is the test conducted by Dr. Lim's team or ourselves? I think the question is answered. You do yourself. You've been taught how to do it, then after that you do yourself. And then the next question is what to do with samples after the test? Good question, Dr. Lim.
So we're going to be showing you when we arrive at your place to show you how to do it. The test kits will be put into a plastic package, small little plastic package. Your worker conduct a test on a table, of course separated from another worker. Having completed a test, he took a picture, the My CMS as I show you, so that we have a record for verification. Then everything then got thrown into that plastic packet and sealed, right? And then that whole package then go into the biohazard bin. Okay, so they are all disposed of appropriately.
Yeah. So if I may add to that, I think you have to buy your own 9 by 6 inches Ziploc bags.
It comes with it. We give it to you.
Oh, you give to us?
Yeah, of course. We give you everything. We give you the kit, we give you the swab, we give you the container for saliva. It comes with everything. Okay. Yeah.
Oh, I thought Kenneth told me to buy the bag.
We probably give you the first time you arrive because it's so cheap anyway.
Okay.
It costs only a few cents anyway. Yeah.
I bought them. So
okay. So
but bring along. I don't know Lazada.
Yeah.
Okay. Okay, so that's very cheap bags anyway. So you dispose them off because you put in a biohazard bag. Question 15. Dr. Lim, from your past experience about COVID-19, what happens to Malaysia next 6 months? COVID-19 causes COVID cases going down or what? Question mark.
Well, I'm sure for those of you who have been following this, the Beta variant, the South African variant, and the Delta variant, the Indian variants, already accounted for the majority of the viruses in Malaysia, circulating in Malaysia. So I don't think this is going to go away so easily. All right, the variants, I think the variants eventually are going to dominate, like they're already dominating in the UK and in India. So it's going to raise a big question whether all the vaccination that many of you have had, are they going to work as well against these new variants? So I don't think it's going to go away so soon. Yeah. So brace for it, or otherwise follow Singapore. Learn to live with it. Yeah.
Okay. So next question is: if workers only work 3 days a week, how to do tests twice a week? That's another one.
I think we may leave that question to when we arrive at your place, because do remember your workers only spend 8 hours or whatever 10 hours in your workplace. The guy then go off somewhere else. Many factories provide quarters. We actually sit down with you and consider how to also protect the quarters. If you have your own in-house quarter, that is the best. You don't have your in-house quarter, you're sharing quarter with other factory workers in some condo or in some apartment somewhere, that becomes a bit more problematic. We will sit down with you and figure out how to manage all that, okay? Because remember, you have the kids now, you can test the workers not just at the workplace, you can test the workers where they live as well. See?
Yeah.
So
fantastic. Yeah. Fantastic. Okay, Hong Yu asked Hong Yong actually. What test can we perform to measure the antibody level for staff completed 2 doses vaccine more than 1 month?
Okay, this is not exactly a question relevant to our discussion tonight, but I can tell you there are 2 types of antibody tests. There's the antibody test, the one you can buy now commercially.
Yeah.
That's called the total binding antibodies. So if the antibody is raised, then quite likely your staff had a fairly successful vaccination in terms of the vaccine inducing an appropriately high immune response in your staff. But there's another type of test called neutralizing antibody test. That's probably the better test again, but it's still not so widely commercially available yet.
I see. Yeah. Doctor, what about the IgG test?
Yeah, that's the one. That's the first test. That is the total binding antibody test.
Oh, total binding antibody. Thank you. Okay, for that clarification. So there you go. Question 18 just came in again. Oh, more questions coming. Oh my goodness, I can't see the end of it. Sean said, if there are staff who stay in isolation from local staff, considering they have no outside contact. Is it advisable to test just the local staff?
I don't think by and large it's a good idea where you differentiate your workers, because from a policy, HR policy point of view, it can be hard to implement. Who get tested, who don't get tested, who get exempted from tested, who don't get exempted. So a universal policy often works better. Everyone are not being discriminated, everyone get tested, everyone feels safe about it, you know. So if, on the other hand, having said that, and I've seen that several times now, you need to be actually a lot more careful with your local workers than your foreign workers. Especially if you have in-house quota and you are able to segregate your foreign workers from the community. And I know many factory does that, regardless of whether that constitute abuse of human rights or not. Okay, so I won't go into that. Okay, I won't go into that. That you're able to some extent enforce segregation on your foreign workers, but you can't do that to your local workers. And let's face it, I think they will pose a bigger risk to you.
Yep.
So if I were you, I will probably test the local workers a lot more often, especially if they are going away, they are on leave, and they come back. You probably test that guy daily. So you see, you are flexible now in the policy. You don't have to stick to a 2 times a week policy. You can have say, oh, you just came back. We don't know your background now. I mean, you will stay with us because we will testing you every 2 weeks, but you're now away. No, we want to have a policy where anyone who returns to us after a leave, they get tested for 3 days in a row. So,
okay.
I work at factories who have this kind of policy. Yeah.
Right. Thank you for that.
Yeah.
Ling says, deep throat saliva and nasal swab both will provide same level of accuracy using the same test method?
I've actually reviewed the data extensively from a lot of research conducted all over the world, including from our neighbors, Singapore, which did a very good piece of work on migrant workers because they were screening them. Actually, the data show fairly consistently that saliva is superior to nasal.
Wow.
I'm actually quite surprised. So again, like Mr. Lim was saying, when someone sticks something into the nose, whatever is sticking in the nose, we don't really know what he's sticking in, you know. There you are. Well, saliva is different, right? Because there's that motion you have to go through, which will show you when we conduct the training.
Okay, thank you for that, Doctor.
Thank you.
This is a good question. The test kits can detect new variants?
No, it doesn't. RTK antigen is quite agnostic to variants. So it doesn't matter how the virus changes, RTK antigen will still come up positive.
Wow.
In fact, that question pertains to PCR. When the variant changes enough of the RNA sequence, your PCR can come out negative.
Wow.
You know that, right? I think that's quite well known. Yeah, some PCR tests will be negative. Or anyway, I should add that remember when you do PCR, you're not testing for one. You're not testing for one sequence of RNA. If you look at the PCR report, you notice there's N, there is the OCR, there is the S gene, the different gene you're testing. And in fact, some of those can come out as negative for certain variants. Okay.
But this one will trap them all, Dr. Lim.
Because antigen test is based on protein. It's not based on RNA sequences which changes in a variant, which is mutated in the variant. Yeah.
So that's a great answer. So rest assured that it will catch them all, you know. Let them... Paul Lee asks, will the personnel distributing and collecting the test kits have more exposure to the virus shedding, hence a higher risk of contracting the virus?
Why would you need anyone to distribute the kits? The kits are there, and the workers pick it up, go to his station, conduct the test, and then that's it. He goes to work 10 minutes later. Yeah.
Right.
There's no distribution. There's no someone standing in front of a guy while he's collecting his saliva. He does it himself. Yeah.
Yeah. I think, Paul, you can refine that question when you meet the team, when you see them. Question 23. Alan Tan says, if I opt for swab test instead of swapping through the nose, we can choose to swab into throat via mouth. Is that right also?
There is something called the oropharyngeal swabbing, right? In fact, some of you who have had PCR tested, you know that they stick something into your nose and then they ask you to open your mouth and swab again, right? So that's called oropharyngeal swab.
Wow.
Oropharyngeal swab actually is not very good. It's not a very good sample. Nasopharyngeal, if you ask me, is a good sample, but it's hard to do yourself. So the most you can do is, like Mr. Lim said just now, is anterior nasal sample, which is the thing just go into the front of your nose and you suck it around and suck it around. It don't go deep inside your nose. Okay. Yeah.
Okay. So
we're showing all this. Yeah.
The saliva test is still easiest and probably you know, and it's about the best too. You know, in this case.
I think so.
Yeah.
The viewer says that. Yeah.
Yeah. Dr. Lim, one small correction. Our president is Datuk Lim.
Ah, sorry. Yeah.
Okay. Yeah, no.
I don't know.
First time meeting, it's okay, forgivable. Sean Ho says that where to dispose biohazard bin? Can we throw it into the general waste?
You can't do that. So there'll be a guy who supply you the biohazard thing who'll come and collect it, and it's actually free because the waste has value. The biohazard waste actually has some value.
Really? Oh,
so it's actually a free service for you.
So your team will contact.
They will tell you how. They will tell you who to contact.
Okay, fantastic.
Yeah.
Okay. Where? Okay. Question number 25 here. And who collects biohazard? Oh, that's understood already. 26. CHT asks, how do we deal with the biohazard box? I think that's asked already. But the next question you ask is, do we need to sanitize the sampling area after daily test? The test area.
Okay, we'll be showing you that, but in collecting saliva, the guy actually have to cough, right? But we'll be showing you the technique. You don't do that with the mouth open. You do that with while masking, all right? Or if that be with a face shield. So I don't think that's necessary. Do remember that your workers are all going to be tested negative. In fact, if your workers are going to be tested positive repeatedly, I think your factory is in serious trouble. Regardless of sanitization, all right? Yeah.
Yeah. Okay, we have two more questions that came up on the screen. I'll ask them. Freddie Loy says, RTK or antibody tests, which are more right applied to those completed vaccinated? In other words, those that are vaccinated, which is a better test, RTK or antibody? I think they're the same, isn't it, Dr. Lim?
They're not the same. So the RTK antigen test is a test of current infection.
Or antibody.
Are you currently infectious, right? The antigen picks it up. The antibody tells us whether you have been previously exposed to an infection or been exposed to a vaccine, right? Because vaccine is meant to simulate an infection without killing you, without causing you an illness. So you will produce antibody. If you have antibody positive, it means either you have been infected or you have been vaccinated. Which is why when we arrive at the factory, one of the things we ask you to do is that would you like to conduct a seroprevalence survey, which is to say, test all your workers, test their blood, just a drop of blood, and find out how many of your workers have previously been infected. If you find a very high infection rate, you really need to be very careful. Okay.
Yeah. So coming back to that test, Dr. Lim, how long does it take to get the result for that IgG test? You call it something else with a long name, right? What's that called?
IgG, IgM. You get the result on the spot as well.
Oh, spot on the spot.
So when we visit you, Eddie, on Wednesday, if you want that, we'll bring along. Oh yeah, you're asking for that. So we bring a test kit along, and we test all your workers. Yeah.
Yeah, I think that's the best way to, like, you know, get the whole picture. Yeah. Then you got two confirmations.
There you are. That's the engineer speaking. Yeah. You want data.
Yeah. Statistically, it will be more desirable, I think. Yeah. As an engineer. Okay, and another question came up again. Nurul, sorry, where is Nurul's question? Deleted. Okay, I think that's about all the questions we have on the screen. Anybody has got any burning question, raise your hand or, you know, unmute yourself and then speak. One at a time, please.
Sorry, Mr. Eddie Fong, there are some more questions in the chat box.
Oh.
I'll just read it out.
I haven't got them.
Yeah, okay, never mind. Okay, the question is from Mr. Gary Ng. What happens to the week that the company goes for PICAS and are supposed to do a test? Would not all the tests run positive for the week?
No. PICAS, meaning you get a vaccine, you have antibody positive, right? You won't get antigen positive.
Okay.
Okay, and then there's one more question. How long should the person who completed vaccination wait before he or she can do the IgG test?
If you ask me, the peak response is about 4 weeks on average, right? So if you want to know the antibody response to the vaccine, test yourself about 4 weeks later.
Okay. One more question from Mr. Alan Tan again. Sorry, Mr. Alan. Somebody asked a question above about a concern of testing illegal workers and sending data to 𝗪𝗂 or government. Is this a valid concern?
Currently, if you are doing screening in your factory, it's like a more sophisticated way of measuring temperature, right? You don't send your temperature data of all the people who come to your factory and you screen the temperature. You don't send them to 𝗪𝗂. 𝗪𝗂 doesn't at this moment accept screening data. 𝗪𝗂 only accept data from lab and from samples collected by doctors in the clinic. So the statistics that's reported by Ministry of Health are all based on 𝗪𝗂, all based on data submitted or reported to 𝗪𝗂. I'm not clear yet at this point in time whether the 𝗪𝗂 or the government expect all screening data to be submitted to 𝗪𝗂. Remember, Selangor government conducted community screening. Thousands and thousands of people have been tested in the community. None of that data was reported to 𝗪𝗂, right? Because it's screening. But if you are screened positive, then you are supposed to go on to have a second test, a confirmatory test, whether another RT-K or the nasopharyngeal swab or otherwise a PCR test. That result will then be reported to 𝗪𝗂. So let's be very clear about this, right? That's the current practice.
Thank you, Dr. Lim. I think maybe we just have another 5 more minutes for questions. Mr. Edipong, there's somebody who raised the hand. Maybe you'd like to ask the person. His name is Mr. Soma Naidu. Mr. Soma Naidu, I think you can.
Yeah, Soma Naidu. Yeah, go ahead. Speak to us.
Yeah, Doctor. Yeah, I'm Soma from 𝗪𝗪𝗪𝗪𝗪𝗪. Okay, I have one question here. Just now I read there's one message, came out in the Twitter. They're saying that semua pekerja sektor perkilangan dan pembuatan wajib menjalani ujian saringan RT-K sebanyak 2 kali dalam tempoh seminggu. So they are focusing too much on the factory workers, and what about the government staff? They also sometimes carry out the inspections, in the factory. So recently, there are a bunch of government staffs. They come to my factory and carry out the inspections. I don't know whether they also carry virus and they can infect my workers. So can we, if there's a people come to the government department to our factory, can we do the same test on them, and then is it a right way to do, or we can ask them to provide their test report before they come in?
Well,
what is your view, Doctor, on this?
That's a tricky question, that one, Doctor. You want to?
Oh, that's not tricky. I've seen so many factories now who they tell the officer who arrive at the factory gate and say, "This is my factory policy. Before you enter, you get a test. We will show you how to do a test," and they test them before they allow them to enter.
Yeah, okay. I just want to add on to this, Dr. Lim. I just want to add on this. Since many of our members are on this session, for those who are having enforcement officers coming to your factory, leaving aside these RT-K antigen tests, you have to also make sure that you take their temperature and go through the SOP, because we know of cases where they come in and everybody goes into a flurry trying to figure out what to do and so on. And then they say that you have not tested them for the temperature, screened them for the temperature and so on, and you get in trouble and you are actually non-compliance of the SOP. Okay, so be very careful about that. And then to Mr. Soma, that question about whether or not the enforcement officer should declare themselves as free from COVID, that question has been raised to MITI. I'm on the MITI chat group. Okay, that question has been raised to MITI. And I'm not surprised that there was no response from MITI.
So Dr. Lim, how do we, Dr. Lim, my question is, how do we respond? If we say you cannot come into my factory, you might get slapped a fine.
Precisely. So that is a very delicate issue. That's the reason why some of the factories have actually asked a question whether or not they should also get a declaration from the enforcement officers that they are COVID-free before they are allowed to come in, because they might be part of the community spread that spreads into the factory. Okay, so the questions were raised to MITI. But MITI has not responded. So I think if you want to say that what is fair, what is not, this is a situation of this is not fair. Yeah. So
Agreed.
So we can't
Eddie,
really
this is Kalam.
Kalam, thank you for coming.
Hi, Kalam.
Okay, Dr. Lim, good show.
Hi.
Just wanted to ask, if you ask me, Dr. Lim, I would ask those MITI officers, enforcements, to do the, same thing, like take the temperature, scan
Yes.
the mice, etc., and everything. But then Dr. Lim, moving forward, what advice would you give to our members on what needs to be done? I mean, in our case, we've already done screening, and that's my granddaughter, okay? And then we are still doing all the screening now. What advice would you give to our members moving forward?
I think this is not so much of the advice, but I think it's more of the compliance of the SOP. There's no doubt that we have raised this question. We have raised two questions about, and I privately also contacted the media officer about two things. One is the cost of conducting the test, and secondly is that the period that is required before the test can be made available. Meaning that people are scrambling to go and look for tests, arrange for this. Right now, enforcement take place when they have not put in place a testing regime. Okay, so now I think you know what happened. Callum, is that when MITI don't have an answer, they just don't respond.
Yeah. But Dr. Lim, just to let you know, I did a virtual PowerPoint presentation to the Board of Trustees of MIER just now, because they were tasked by MOF to compile, what's happening on the ground with FMM, with media companies, SME, and all that. One of the things I told the Tan Sri Sulaiman Babok, who was chairing the session, was that I said we should look into weekly testing and not bi-weekly. It's just too expensive, too cumbersome. The other thing, I also made it very clear that they should get all the agencies, ministries and agencies, enforcement officers from all the ministries and agencies to be aligned to go for a common, session where everybody talk about the same SOP throughout. And also that these officers to add in the chapter on sympathy and empathy, and that the job is to help, these are tough times, is to help all these companies, especially SMEs, and tell them, okay, maybe Callum, you are not doing this right, you should be doing this or that, and then I'll come back 3 days later and make sure that you're doing all the corrective actions, rather than just slam us with, compound, and more compounds. So they all agree and they're looking into it.
Yeah, okay. Dr. Lim, sorry, this is a bit of a digression from your RTK antigen thing, but since this question was raised, let me share what has been happening. I deal with MITI on two angles. One is through the MITI chat group where Callum is there as well. And many of the things I also go privately with some of these senior officers so that it's easier to do that. Now, this question was also raised because we have had members who have been enforcement officers going there and spending 2 to 3 hours trying to find the smallest of problem to slam them for SOP. And obviously, there are certain reasons why they're trying to do that, which I will not go into that in this forum. But the problem here is that, yes, empathy and sympathy must be required, and that has been raised. I think the authorities are aware of some of these issues. As to whether they are going to take action and how they're going to action, that's still not something that I've seen. Seriously, I know of one particular case where they spent 3 hours trying to find fault. Okay, and that is very bad. And this guy came to me and told me, he says that during the period, they were asked to all stand around and not operate, and the machines have to be shut down during the period. So that particular case is a very bad case. I won't mention the name of the company, but it is extremely, extremely bad. And that's not what enforcement should be, okay? I'm an accountant by training, Dr. Lim, I'm an accountant by training. I do audits those days. And in an audit, you do sampling tests. In any sampling test, you will always find non-compliance. Now then, you will break it down to major as well as minor. And very often, when it comes to minor, people are given the opportunity to rectify it with the requirement that they show that it can be rectified by the following day or whatever hours. That's not been practiced by the enforcement. They seem to be having a KPI where the higher number of factories that are shut down, the better is their report card. So that's a wrong way. Right?
Okay, Dr. Lim, thank you very much for the comment.
Coming back to this question, Dr. Lim, I think Callum brought out one point that I wanted to bring up, that I was hesitant to bring up, is this question about, Callum mentioned about what if the test is reduced to 1 week for cost reasons and also for managing the factory timing and so on. I have this question on my list to ask, but I was pretty impressed by your presentation as to why frequency is more important than sensitivity. Okay, that is something that in a way caught me by surprise, because by the way, Dr. Lim, my son is studying in the US. He is in a university where Moderna's office is just a few meters from them.
Wow.
Pfizer is just a few meters from them. And they practice only once a week. And it is actually an anterior nasal swab. And the students have to do them themselves. If they don't get the test done weekly, their app is not updated. They can't even open the security door. But they're doing it once a week. And that particular university is crawling with the guys who are either in Pfizer or in Moderna. So I'm not sure why they have only limited to 1 week and they see it as sufficient.
Yeah.
Well, like I was trying to explain in that graph, 2 factors drive it, right? Frequency of testing and community transmissions. If your factory is located in Balakong or somewhere in Klang, I would advise you to go on weekly testing. On the other hand, if your factory is located in a nice place where Callum factory is, you can probably get away with weekly testing. So the degree of community transmission is the critical factor. And secondly, obviously, how many of the workers are vaccinated? How intensive do you practice other preventive measures besides just testing? I've seen some very good factories that really got none of the workers ever infected now. So I think all these together, all these measures complement each other. If you do them all well collectively, well, you can get away with weekly testing. I have no doubt about that. Yep.
Okay.
Dr. Lim, you mentioned about the enforcement officers trying to find fault. Last week, the people from MBSA, Shah Alam near my place, came to our place. We showed all the record, they checked, went through the factory, they couldn't find anything. In the end, they told my people, you guys should not be operating 24 hours. You should be only operating 8 to 8. I told my team, don't argue with them. You know, I told them, don't argue, just say, okay. And then, you know, they say, that's it, okay. I mean, sometimes no point arguing with them. Again, they may or may not know, you know, the SOP well, or they just trying to find ways to try to, you know, do something funny like.
Sally, okay, Dr. Lim, let's coming back to this subject matter. The million-dollar question here is that you have been involved in many factories. This was even before the SOP was implemented. Since then, it became mandatory under the SOP. Has the test results and the method of using conducting the test, as well as the test kit, has it been accepted by MITI or DSTS, KKM, and so on?
Well, we have not had any dealing with MITI, obviously.
Okay.
Do remember the program is conducted under MOH research protocol. So to the Ministry of Health, this is research. To you, of course, as an employer, this is a good tool to help protect your workplace. But to us, basically, we are doing a research to find out whether such a tool, potentially costly tool to employers, whether that will mitigate the transmission of COVID-19.
Yeah. The reason why I brought this up is that we know that the test kit that you have shown us is MDA approved, which is under KKM, and that it's been used for quite a while. The only thing here is that we had a session with the DG last week, and went through a 3.5 hour session with us. It's just amazing that that man can go to 3.5 hours on a Sunday. It was on a Sunday, last Sunday, the previous Sunday, in fact. But the thing here is that he mentioned that only 2 RT-PCR antigen tests is being considered for approval. Now that caught us by surprise because we know that there are many RT-PCR antigen tests in the market, and privately I have been given 2 names, but leaving aside the 2 names, but would that be a problem in the case of using the set that you're using, that you have you're doing the research with?
So we tell all the employers, you can buy the kits that. You can buy any kits you want that's in the market, really. Because to me, it's not the kit per se. It is how well you are trained in collecting the saliva. No matter how good is the kit, if your workers are lousy in collecting saliva, it's not going to be good. And number 2, frequency matters more. So we emphasize that. We don't want to just overemphasize one factor, which is the kit per se. Yeah, I know that ST's biosensor kit is probably better because it costs $30-40 bucks. On the other hand, you've got some cheap kits imported from China that only cost sub-A-man, So you choose as an employer, what your budget allows you. If you really want to get one of those fancy kits, go and buy it. I mean, buy the American kits. The one from Abbott is pretty good. I think it costs about 13 Singapore dollar per kit, right? I mean, you can buy them. You can buy them from Amazon.
I think here, I think here, Dr. Lim, as far as our members is concerned, is that because many of our members has got a large number of workers, so obviously cost and efficiency is a big issue to them. And being an accountant and looking at the cost structure that you have offered and recognizing the fact that it is actually research-based that in a way brings down the cost, certainly I would strongly recommend that kit. And I hope that that is acceptable to KKM as well. That's the only thing that I worry about. By the way, Dr. Lim, I am actually a retired person. Okay, so
get back to work, huh?
No, I'm not even working at all. I'm not even working at all. I'm not a shareholder, employee of any plastic company. So the question I've raised is a non-interested, non-vested interest question. So I don't have any reason to say yes or no, or to promote or not to promote anything.
I think those are the best people to get on the panel, Dr. Lim, don't you think? No vested interest. He's unbiased totally. So very good, Dr. Lim. Dr. Lim, I think we have to push this test method to MITI and say that, look.
I think you all should, as an industry association, do that.
We should push it not only through MPMA, but through all the others who are willing to come along.
That comes to the one last question for me is that I've been given a draft of a document that looks very interesting. So I'm going to edit a bit here and there on that just to make it a bit different. 2 questions here, Dr. Lim. I know that that sample has been given to various parties. Are you aware of, number 1, anyone else who have submitted? And number 2, who do we submit it to?
Dr. Lim, this is the document that you sent to me. I forwarded it to MP.
I'm just writing. I'm just submitting that to you as a researcher who is quite well informed on these matters.
Basically,
so I'm just sharing my knowledge and experience with you. That's all.
Basically, Dr. Lim, I see a lot of sense in the document, and we want to submit this document to the government. So that share the thoughts in there. So I just want to know whether any other associations have done that, and also more importantly is that who do we submit it to?
I have no idea. I've now dealt with industry. Remember, I'm a researcher, okay? In my little ivory tower, Dr. Lim?
Okay. So we will figure out whether we should submit it to someone in KKM or we should submit someone to MITI.
Use them freely. Use them freely. I'm always happy to share.
Dato, I think Dr. Lim has said, whatever he shares with us, use it freely. So maybe we should share with the other associations also who are trapped in this 2 times a week SOP thing, so that we can, 25 associations can,
we have actually extended this session to some other associations for them to be aware of this is happening. So that's not a problem. I'm on the chat group with all the associations in the country. So.
You're a busy man, Dr. Lim, for retiring. Duty calls.
Okay. So, can I bring you guys back to there's another question, Doctor. How about staff in the office area? How much do the test kit, or What about the office staff? I
We
think
test them all.
test them all.
Yeah.
Okay, I think that'll be the last question. Thanks very
Yes,
much.
please. Thank you.
Hello.
Who is that?
Dr. Lim, Dato' Lim, this is Martin.
Okay.
Hi, Martin. Hi.
I'm
Yeah.
Martin from Julie Biscuit, okay?
Yes, yes.
So I have been following your session just now. Let me share something.
Sure.
I have been using this, I came to know Dr. Lim somewhere around May. So I have been using the test kit since end of May, all right? Recommended by Dr. Lim. All right, so we have been, we started in KL, Kota Damansara office, which is about less than 100 workers. And then apparently we find that it's quite interesting, quite useful, because that time Selangor, I think you know the number of cases are of course not comparable to now, right? But then and then we after using for a week plus 2 weeks, I recommended to my boss because my factory in 𝗪𝗥𝗪𝗏, Malacca. So my factory has 1,000 over workers. All right, so Mr. Lim and his team, Dr. Lim and the team went down to Malacca to give training. All right, and then after that, from early of June until today, we have already carried out for more than a month already. All right, and of course, I would say that it's very useful because 1 week we tested twice, lah. All right, and then just now to answer your question, those government people come and do, they come and inspect us, and many people come and inspect us. We tell these people, you please go and test also before you come into our factory. I want to tell you, it's true. This is what we did. You need to test before you go in.
So, Martin,
Yes.
what is the answer to that? Do they comply or they say no?
They comply.
Wow.
We tell them, we don't care. In West Malacca, people came in, and some of the meaty people, many people. So far, I think there are 3 groups came, in the last couple of months to inspect our factory. All right, we tell them a test because all along we ask our supplier who came into our factory, every one of them they test. Before the kit came out, we ask them to test before you come and meet our people.
Wow.
All right, so today I want to share with you, when we came to know Dr. Lim and the team, until today, we have started to use not only the factory, whole Malaysia, all my sales office. So they're all together 1,300. It's very high cost, to be frank with you. All right, but we have no choice because we discover many things happen in our branches in Penang, in KL, in other places. But you have to remember, if any of the people got COVID positive, they will ask you to close down your office.
Yeah.
So can you imagine if you close down for 1 week or every places close down, my factory closed down, I think we lost a lot.
Yeah.
Right? We lost more actually. That's why we have no choice. We are quite glad that at least we met Dr. Lim and then we use it until today. We hope by the time I think we can vaccinate all the workers.
Yeah.
That is our last resort. Then I think we can stop with it.
Right. Thank you, Martin. Excellent sharing. Thank you. I think that's an endorsement on the method and the testing, Dr. Lim. So now we have a very powerful tool. If they want to come and inspect, ask them to do the test. Otherwise, no go, no entry. So I think I will use that as a deterrent for them to come and catch us.
Wow.
It's a legitimate request. You ask us to, take all the prevention SOP. This is our SOP. So that's great.
Yes.
All right. I think that's about all the questions that the board. So Dr. Lim, I want to really express my sincere thanks to you. And for doing such a great job, with this screening test and so on with your team. You tell me that you are above 60.
Yeah, of course.
Looking at you, I don't even believe that. not to call you a liar, but you look hardly 50 actually.
No. I'm retired from government service. Okay, please.
Right. Yeah,
Eddie.
Kelly.
Dr. Lim has secret he has not told us, okay? That will be a private chat altogether.
Yeah.
And if you want to find out how he stays so young, looks so young, feels
Dr.
so
Lim
young.
has taken a lot of vaccine already. That's why he tried the vaccine.
Okay.
No secret,
That will
just
be
stay
another
healthy.
subject. That one will be another subject.
I have his number, so I will talk to him privately and see what's his secret about.
You can also ask me.
Yeah, Callum. Ask Callum, yeah.
Yeah, you
Thank
can
you
also
very much.
ask me.
Really appreciate the effort, the time.
Thank you.
You know, I think it's really benefited many of our members who are on here. 260 over. I saw the highest count. And I given them another avenue. Like, you know, it's not so desperate now. At least we have an avenue. So let's hope that MITI or the MKN can give us some sort of a grace period, because I know your team is going to have very little sleep after tonight, because the 200 requests coming in to do the screening and so on. So really, I hope that this is what we can do to bring the numbers down and, you know, open up our industry again, you know, in the near future. Thank you very much. Over
Thank
to
you
you,
very much.
Sujata. Thank you. Thank you.
Thank you.
Not
Thank you,
only
Mr.
that,
Rico.
Dr. Lim, a lot of
Thank you,
people.
everyone.
Thank you.
Stay
Okay.
safe.
Take
Wait,
care. Stay
before
safe.
everybody goes, before everybody goes, can we have a group photograph? Must have a group photograph. So all those in this meeting room, can you please switch on your videos so that we can see all your handsome and pretty faces?
Half of them have left, Sujata, but never mind.
I know, but never
Yeah.
mind, better than nothing.
Better than nothing. Yeah. Or put it on gallery view lah. Then we
Yeah, it's on gallery view.
can switch on your.
Sujata, I think the presentation will be in our Facebook.
It's on the presentation is on the website. I've also shared
Okay,
the
so
QR
that's true.
code
The
together
other
with
one, the other one is Eddie. You notice, like Martin and so on, we have non-members, non-MPMA members here,
Yes,
because
yes.
this was shared to the what do you call, the association chat group.
Correct. Yeah. Even some of my friends are on. I saw their names.
Yeah.
Yep.
Okay.
I think there are a lot of people.
Okay.
Okay. A few
But
more
not-
people. Just another 1 second, 2 seconds. Switch on your video quickly.
Turn on your video, please,
Yes.
everybody. Turn on your video. You know.
Okay.
Good to see you again, Kate.
Okay. 1, 2. Everybody smile.
That's
Smile.
it.
The second shot. Okay. Thank you so much. There's somebody who raised their hands actually, Mr. Chris. I'm not sure, Mr. Eddie, if you want to take the question.
Yes.
Thank
I got a question.
Yeah,
I think for those tests, right, it's actually only applicable for adults. How about kids?
Oh. Dr.
Kids
Lim?
are harder. We have schools now asking about this. So we think anybody age 12 above can be trained to do the collection.
Oh.
But age 12 and below can be, I think, quite difficult. Yeah.
Difficult, yeah.
Because you need some coordination to collect the saliva. Yeah. But schools will be using it. Secondary schools will be using it soon when they reopen.
Oh.
But they can be tested, right, Dr. Lim?
Yes. Well, Martin's boss in Malacca, I think he's going to be a major sponsor for this test for some of the schools in Malacca. Yeah.
Wow, great job. Great job, Martin.
All right. Thank you so much.
So I think that will be the last question. It's 7:30, 7:43. My goodness.
Yeah.
Everybody
I think
is
we better let Dr. Lim go.
Yeah, we better go. Otherwise, we'll be here
Thank you.
till 12 o'clock. Thank you, Dr. Lim.
Okay,
Thank you.
Dr. Lim.
Bye-bye, everyone.
Okay,
That was a
Bye-bye.
great
Take care.
Dr. Lim, thank you very
Everyone,
much.
stay safe.
Stay safe.
Bye-bye, everyone.
Stay safe. Bye. Bye.
Bye. Bye. Bye. Bye. Bye. Thank you. Thank you.